Going to the gynecologist can feel intimidating for many people. It involves discussing very personal aspects of your health and body. However, it's one of the most important things you can do for your well-being. A gynecologist is a doctor who specializes in the female reproductive system. Think of them as your dedicated partner in health, someone who is there to support you, provide accurate information, and help you navigate the unique health journey that comes with being a woman. They are trained to handle everything from routine checkups to complex medical issues, ensuring you receive the best care possible for your specific needs. It's about building a trusting relationship with a professional who has your best interests at heart. Understanding what these doctors do is the first step toward feeling more comfortable and empowered in their office. Their main goal is to keep you healthy. This includes your vagina, uterus, ovaries, and breasts. They help with so many different things. For example, they can help you with your period, with getting pregnant, or with not getting pregnant. They also check for serious problems like cancer. Visiting a gynecologist regularly is a proactive step. It means you are taking control of your health. It is much better to prevent a problem or find it early than to wait until it becomes serious. These visits are a safe space to ask any question you have, no matter how small or embarrassing it might seem. The importance of this medical specialty cannot be overstated. Throughout history, women's health was often misunderstood or overlooked. The field of gynecology has evolved to focus specifically on the complex and wonderful workings of the female body. These doctors are advocates for women's health, armed with scientific knowledge and medical expertise. They work to dispel myths and provide evidence-based care. When you see a gynecologist, you are benefiting from centuries of medical progress, dedicated to understanding and treating conditions that affect only women. This specialized focus ensures that you get care that is tailored to your body's unique biology and life stages. So let's reframe the yearly visit. It's not just a medical appointment, it's an act of self-care. It's an opportunity to learn more about your own body and to ensure everything is functioning as it should be. The more you know, the more confident you can be in your health decisions. Your gynecologist is there to guide you through puberty, your reproductive years, menopause, and beyond. They provide a continuum of care that adapts as your body changes. Establishing this relationship early can make a significant difference in your long-term health and peace of mind. Remember, knowledge is power, especially when it comes to your own body. A gynecologist's job covers a very wide range of health services for women. Their care begins with young women, often during their teenage years, and continues all the way through menopause and postmenopause. They perform annual exams, which often include a PAP smear to screen for cervical cancer and a pelvic exam to check the health of your reproductive organs. These preventative screenings are incredibly important because they can detect potential issues before they become serious health problems. They also provide counseling on topics like contraception, safe sex practices, and the HPV vaccine, empowering you to make informed choices about your reproductive health. Beyond preventative care, gynecologists are experts in diagnosing and treating a wide variety of conditions. If you experience issues like painful periods, irregular bleeding, pelvic pain, or infections like yeast infections or bacterial vaginosis, your gynecologist is the right doctor to see. They can also manage more complex conditions such as endometriosis, uterine fibroids, ovarian cysts, and polycystic ovary syndrome, often called PCOS. They use their extensive training to figure out the root cause of your symptoms and develop a treatment plan that is right for you. This might involve medication, lifestyle changes, or sometimes a medical procedure to provide relief and improve your quality of life. Gynecologists also play a crucial role in a woman's journey to motherhood. They provide care before, during, and after pregnancy. This field is often combined with obstetrics, and these doctors are called OB-GYNs. They help with fertility issues, provide prenatal care to monitor the health of both mother and baby, manage labor and delivery, and offer postpartum support. They guide women through the physical and emotional changes of pregnancy, ensuring the safest possible outcome. Their expertise is vital in managing high-risk pregnancies and handling any complications that may arise, making them an essential part of the childbirth experience for millions of families every year. Finally, these doctors are specialists in the changes that happen during menopause. As women approach this new stage of life, they often face symptoms like hot flashes, mood swings, and vaginal dryness. A gynecologist can offer guidance and treatment options, such as hormone replacement therapy, to help manage these symptoms effectively. They also focus on health risks that increase after menopause, such as osteoporosis and heart disease. By providing continuous care, a gynecologist supports a woman's health and well-being across her entire lifespan, adapting their approach to meet her evolving needs and ensuring she can live a healthy, active life at every age. Sometimes, a gynecologist needs to perform a procedure to diagnose or treat a condition. One common procedure is the colposcopy. A colposcopy is done when a Pap smear result comes back as abnormal. It lets the doctor look at the cervix more closely. The doctor uses a special magnifying instrument called a colposcope. It's like using binoculars to get a detailed view. This helps them see any abnormal cells on the cervix that could potentially become cancer. If they see something unusual, they might take a small tissue sample called a biopsy for testing. This procedure is vital for catching cervical cancer early when it is most treatable. An interesting fact is that the solution used during a colposcopy, acetic acid, is essentially just strong vinegar. Another procedure is called a dilation and curettage, or D&C. This involves dilating or widening the cervix, and then using a special instrument called a curette to remove tissue from the lining of the uterus. A D&C is done for several reasons. It can be used to diagnose conditions like uterine cancer or to remove tissue after a miscarriage. It can also treat conditions like heavy bleeding by clearing out the uterine lining. The procedure helps by providing a tissue sample for diagnosis or by resolving a specific problem within the uterus. A surprising fact about the D&C is that it was once a very common method for abortion. But modern medicine now has safer, less invasive options available. Hysterosalpingography, often called an HSG, is a special kind of X-ray. It is used to look at the uterus and fallopian tubes. This procedure is often done for women who are having trouble getting pregnant. During an HSG, a special dye is injected through the cervix. This dye fills the uterus and fallopian tubes. Then, X-ray images are taken. The doctor can see the shape of the uterus and find out if the fallopian tubes are open or blocked. Blocked tubes can prevent pregnancy. So, this test helps find the cause of infertility. An interesting fact is that some studies suggest the procedure itself can slightly increase the chances of pregnancy in the months following the test, possibly by flushing out minor blockages. Mammoplasty is a term for plastic surgery performed on the breasts. This includes breast augmentation, which means making breasts larger, breast reduction, which means making them smaller, and breast reconstruction after a mastectomy. Breast reduction is often done for medical reasons, not just cosmetic ones. Very large breasts can cause chronic back, neck, and shoulder pain, as well as skin irritation. The procedure helps by removing excess breast tissue, fat, and skin, which alleviates physical discomfort and can improve a woman's quality of life. An interesting fact about breast reduction is that it has one of the highest patient satisfaction rates of any plastic surgery procedure, largely because it provides significant relief from physical pain. Women's health needs are not static. They change and evolve with each passing decade. A gynecologist is uniquely positioned to provide consistent and relevant care throughout this entire journey. In adolescence, the focus is on education about menstruation, providing the HPV vaccine, and establishing a foundation of trust. During the reproductive years, care shifts to contraception, family planning, pregnancy, and managing conditions like endometriosis or fibroids. This is a time when having a reliable health partner is crucial, as you navigate some of the most significant decisions and experiences of your life. The relationship you build with your doctor is key to feeling supported. As you move towards perimenopause and menopause, your body begins a new transition. This phase can bring a host of new challenges, from irregular periods and hot flashes to changes in bone density and cardiovascular health. Your gynecologist becomes your guide through this natural but sometimes difficult process. They can help you understand what is happening to your body and offer solutions to manage your symptoms. They provide screenings for age-related conditions and offer advice on maintaining a healthy lifestyle. Their role is to help you navigate menopause not as an ending, but as a new chapter, empowering you to stay healthy and vibrant for years to come. Then there is the stage of postmenopause. During these years, preventative care remains just as important as ever. Your gynecologist will continue to monitor your gynecological health, screening for cancers of the uterus, ovaries, and vulva. They will also manage issues like vaginal dryness or pelvic floor problems, which can become more common with age. The goal is to ensure your long-term health and quality of life. This lifelong care model means that your doctor gets to know you, your history, and your health goals intimately. This continuity of care is invaluable and leads to better health outcomes, as they can spot changes and address issues more effectively over time. Taking charge of your health is one of the most powerful things you can do. Finding a gynecologist you trust and seeing them regularly is a fundamental part of that. Don't be afraid to ask questions, voice your concerns, and advocate for yourself. Your health is a partnership between you and your doctor. By staying informed and proactive, you can navigate every stage of life with confidence and strength. Celebrate your body, understand its needs, and prioritize your well-being. A healthy woman is a powerful woman, and your gynecologist is here to support you every step of the way on that incredible journey.